Thank you so much. Thank you for joining us today. We're going to spend some time together thinking about how to use a template that I found in the literature, the Next Generation NCLEX literature, and how to use this template to guide us through the process of writing a case study that will focus on clinical judgment and kind of tailor our thoughts and our processes towards our goal, which will be to use teaching strategies that enhance our students' ability to develop their clinical judgment skills, as well as to be able to better answer the next generation NCLEX item types that we'll be learning more about on Friday at noon. We do want to promote the presentation on Friday at noon. Dr. Desiree Hansel will be beginning to discuss the various item types. And so today's session kind of melds directly with Dr. Hansel's presentation on Friday. So I will kind of point out how that's going to work as we move along. So we do just have some general reminders that you are to place your questions in the chat box for our question and answer session, which I will take breaks along the way so that at logical points along the way so that you can ask your questions. I do have Dr. Crystal Devance Wilson monitoring the chat box for me. So please feel free to place your questions in the chat box as you develop those questions. Your audio needs to be muted so that we don't have stray background noise and feedback, and we hope that my puppy that's laying right next to me follows that rule as well. And in order to receive the contact hours, you must complete the CE evaluation that you will receive via email after the event is over. And all of the materials are currently found on the Maryland Nursing Workforce Center website under the event tab. And so I did check that this morning, and those materials are there for you. The presentation PowerPoint, the the case study template. It is a PDF, so you will have to modify that for yourself, but I do have a Word version of it that we'll be using today. So save a copy to your desktop so that you can use that again in the future and work with your colleagues at your colleges and universities. We do have to state that I do not have any financial relevant relationships with any companies to disclose. None of the planners or speakers for this activity have any financial relationships to disclose. And the University of Maryland School of Nursing is accredited to provide continuing professional development by ANCC, and that is who you will earn your contact hours through. And you may receive 1.5 contact hours for attending the activity today. And to receive the CE, you will submit the following, which is the completed activity evaluation that will be sent to you. If you are watching the enduring materials, there will be additional materials at the end of the presentation for you to view. So the learning objectives for today are to consider appropriate sources for case study topics. So when we think about writing case studies, we want to think about what should we write the case studies about. To organize key elements of the case necessary for making effective clinical judgments. And I am going to be using the National Council's clinical judgment model, but I will talk about how you can modify the template to use another clinical judgment model or to use the nursing process if that is what your program has chosen to use as the model to work with your students to help them make clinical judgments. And then later in the presentation, I will share with you the template that we will be using to develop a simple case study. And I'll show you an example of a case study that I have developed very quickly, actually, just I'm hoping that this isn't an intimidating process for you, and that you'll find that using this modified template really helps you to move along and develop case studies that you can use when teaching, when assessing, and when evaluating your students' ability to make clinical judgments, really in any setting: classroom, clinical, simulation, and skills lab. And so just to remind ourselves, what is clinical judgment? And I like this image, and I liked it because it kind of leads the eye to the right, which of course is our outcome for today's work in writing our case studies, is to try to enhance our students' ability to make clinical judgments. But backing up a step or two, we want to kind of remind ourselves that, clinical judgment is the result of a process of decision making. And so it's the end, it's not the beginning. And so our students need to be encouraged not only to use critical thinking, but also to know how to use clinical reasoning and rationalization to then make the clinical judgment. And so some definitions here. So clinical judgment is the conclusion, the decision or opinion that a nurse makes after they consider the issue, that they are using critical thinking and clinical reasoning to make that decision. So it's important that we understand that it has, many elements that come kind of before the judgment or decision is made. And so let's begin by thinking about what should we write our case studies about? What should the topics be? And certainly we begin with our course or our lesson learning objective. And we could consider in our program that we could have a case or a case study in the form of a simulation that students would have to pass at the end of a course. That would be a summative, almost high stakes type of an experience. Could be, as I mentioned, a simulation, or it could be in your classroom. So a case where you do a mini lecturette, and then you have a case study available for the students to work on and to consider. Another way would be to begin class the following week with a mini case study from content from the previous week, which really enhances scaffolding and enhances recall for students, and is sort of a key to enhancing long-term memories and retention. So something to think about there. And I built my case study example today from a learning objective from my class last week. So I got to thinking about it, and I thought I'm just going to think about something that I just taught about last week. So we'll look at that in a few minutes. The article that I have referred to you also talks about the importance of these cases to be based on common clinical situations for an entry-level nurse. So these cases should feel pretty straightforward to you, simplistic. They should be situations where an entry-level nurse will have to make a decision. And we don't want them to be kind of strange one-offs to really feel like it's an unusual or uncommon situation. We want these cases to enhance and reinforce information that our student nurses will face commonly as an entry-level nurse. And so where does this information come from? Well, I will share with you a couple of sources that I have used. One of our clinical partners shares their nursing practice council minutes with us as course directors. It's part of our sharing process and information sharing and kind of communication process. And so I look through these minutes that we get on a regular basis. I don't think they're monthly, but they're on a regular basis. And what I'm looking for are things that are close calls, or what you might call a no harm event that is being notated so that a learning process can occur, or near misses. And so some of the examples that I got from the minutes of this practice council were things like blood transfusion identification not being thoroughly completed, behavioral issues with family where the nurses had to make decisions about family members at the bedside and decisions that are often very difficult and emotionally heavy. They also mention commonly issues in the normal function of equipment, such as the nurse being able to assess the normal function of chest tubes, IV pumps, fecal incontinence devices. So all of these having the potential to cause harm, but in these cases, there was no harm, but the event raised the concern of the clinical educator. And so we could create a case where the student nurse is faced with a malfunction, let's say of an IV pump, and having to decide what is the next steps when this occurs, maybe with a high risk medication being infused. The practice council also mentioned the 5 rights of medication administration and what to do when a medication is missing or when a patient is not on the unit to receive that medication at the right time. So kind of a commonplace nursing skill where you have added a little bit of a twist to that so that the students are having to make a decision. Do I find the patient down in the radiology department? Is it a key and essential that this IV antibiotic is started, within the 1-hour window or the 30-minute window? So, and last but not least, the practice council described issues with the heparin protocol. So mostly surrounding the when to restart. So nurses were very clear on when the heparin infusion needed to stop, but when would the infusion be restarted? So simple cases where the student nurses are having to work through those very common clinical situations that they're faced with potentially every shift, right? A missing medication, what to do about that. Then secondarily, I engaged in a IRB approved survey of our clinical instructors. Now, the literature also supports surveying nurse managers and asking for examples of similar student situations where, the student almost had a close call or almost made a mistake or did make a mistake. And so some of the examples that I got from that survey were, again, medication administration, problem solving surrounding that. The clinical instructors mentioned swallowing issues, patients being confused, new onset of confusion, what to do about the medications should that occur. They also discussed the need for us to have students practice with assessment before and after medication administration. So developing a case surrounding should the medication be held, should the medication be given, and or an untoward effect of a medication that has been administered and how to work through that problem. They also mentioned psychiatric mental health issues with patients across all unit types. So for student nurses to practice using their communication skills and psychiatric mental health interventions in other types of clinical care environments like med-surg or OB or PEDS. So they mentioned that students don't always think about applying the skills that they've learned in their psychiatric mental health course in non-psychiatric care units. They also mentioned students needing experience with how to intervene with psychiatric mental health patients experiencing acute symptoms, active symptoms. And so developing a case where the students can think through that and make a clinical decision and judgment in that environment. And last but not least, the survey showed issues of communication struggles that students have with patients with different languages. So having to make a decision about how to interact or intervene when the patient speaks a different language, patients with a tracheostomy, patients with confusion. So these are some ideas about ways to get feedback and ideas about these cases that we're going to be developing. I also mentioning that the Joint Commission looking at sentinel events or never events and developing cases around those to prevent those types of events from occurring so that the student nurse is able to see a case, maybe a perioperative case, where they can make a clinical decision about whether this patient should be sent to the OR or not, given the certain circumstances. Other resources could include NLN simulation and layered all cases, where you can get ideas and you can use the electronic health record that is in that software to develop a case, or to use a clinical judgment textbook or workbook to also get ideas for your future cases. So a few ideas there for like where do we get these ideas for cases from? And so just a little bit about the template and sort of the origin of the template, and then we'll take a look at the author's original template and then how I have modified it for our use for today. So the original article where the template was published is listed here, Betts, and actually it looks like I put an apostrophe S and that isn't included in his name. And so Betts is the author that wrote this really helpful journal article about using the template that they developed, and we'll look at that in a minute. And then what I did was I added some other elements from the literature that I thought fit really nicely in the template that would kind of round out the templates. We could use it kind of from start to finish, you know, from developing the case study all the way through to developing potential next generation NCLEX item types. And I even added from a continuing education that I found that Dr. Billings wrote some educator prompts for each of the steps so that if we do use this in simulation or in the skills lab, it would give us some built-in prompts for each step. All right. So I put this in kind of what we're going to do today and what parts of the process we're going to do together today. And then we'll take a look at the template. So today we have talked a little bit about how to identify a topic or a learning objective that will be developed into a case study. And then we are going to identify the content for each step of the clinical judgment measurement model, layer 3. And then we're going to think about what contextual content we might want to add to our case that will give it a realistic feel, a unique feel. And then we're going to write a case study. And then this is where we're going to stop today. So we're going to stop kind of after we have worked together in smaller groups to develop a case study. And then we'll look at the template, the original template that I kind of modified. And on Friday, you will be hearing more about the item types and kind of how they then will fit into your case study so that you can then develop with Dr. Hansel some of the item types that would refer right to the case study that you have written today. And last but not least, once you have written your items for your next generation NCLEX style items, you're going to include your rationale or reference. And also you want to have another faculty kind of verify that this is appropriate for the entry-level nurse, that we are addressing the learning objective, just to sort of have a verification process. All right, so what I'm going to do is first show you the original template from the literature. So I'm going to exit out of my PowerPoint. I'm still sharing here. And I am going to, let's see, stop sharing just for a minute. I'm going to take a breath and let me pull up that. There we go. All righty, here we are. And now I'm going to go back and share my screen with you. Let me pull this over. Having two screens is a blessing, but managing it during a Zoom is a little nerve-wracking. All right, here we are. So if somebody could just confirm to me that you're seeing the document called Template to Develop Clinical Judgment Item Types. Crystal, if you can just.
Yes.
Okay, thank you so much. All righty, so this is the, actually, I'm sorry, this is my modified document. I want to show you the original one from the literature before there we go. Sorry about that. Before I want to give full credit to the author for their original, here we are, for their original template. So
yes, we see it.
Thank you so much. So I wanted to just sort of work you through Dr. Bett's original ideas. So I'll give full credit to them for this template. So they had the scenario or the case study here in the first column. And you can then see how they added the clinical judgment kind of element, layer 3 of the National Council's clinical judgment measurement model. And then straight down, they have recognized cues, analyze cues, prioritize hypothesis, generate solutions, take action, and evaluate outcomes. So they have all the steps of layer 3 here. And then they talked about the nurse educator who is developing this case study, writing what the expected behaviors of the student are. And so the expected behavior for recognized cues would be that the student could recognize abnormal versus normal findings, could recognize signs and symptoms that are abnormal, could identify from a past medical history, a history of something that would be important to know and recognize. And so taking this sort of template all the way across, the next thing that the author added were the conditioning factors, or the items that you find in layer 4 of the clinical judgment measurement model. Things like, what about the environment? What setting are we talking about? Were there any patient observation cues that we want to have the student who's reading the case study know? For example, is there family at the bedside? Are there any cues in the medical record that we want the student to see if we have a medical record available for the student to view? And then last but not least, this author has now at their last column where you would write the item. So this is where you would write the next generation item here in this box. And you would include your rationale, and you would include a step of verification. And I mentioned that, having another faculty evaluate, are we measuring the correct step of the clinical judgment model? Is it accurate? Is it fidelity, meaning is it true to its nature? So basically the author is saying, please make sure that you have a process where someone else is going to be reading your elements of your case so that it rings true to nursing practice. And so while reading this, I thought, well, I think I can make it a little bit more user-friendly was really my goal. And so I'm going to go here, and that's not the one I want to show you. Hold on one second. Let me pull up the my modification of this document for you. Okay. Let's see here. Pull that up. I want to make sure I get to the right one. All right, so here we are. So I call this, and this is the document that you have available. Crystal has placed a link to this Word document in your chat box. And a version of this is available on the Maryland Nursing Workforce Center's website. This document, hold on one second. I want to share. I know I've got 3 different things going here. I want to share the full template. Okay, sorry about that. I have to go back one. I'm so sorry. Okay. All right. Well, I'm having trouble. Give me 1 second, please. Case study. Let me go to.
Kathy, do you want me to share?
Just give me 1 second, Crystal. I'm actually going to share what is on the website because that is exactly what I want them to see, and they have full access to this. So this is sort of my variation of the author's template. And so you can see there are a lot of similarities. I begin at the top, but as a nurse educator, wanting you all to first identify the topic and the learning objective for your case that you are writing. So it's really important that you think about your students' learning objective, maybe even thinking about what you taught about this week or last week, and think about what is it that I want my students to really get from one component of my lecture. And so I put that at the top. And I moved the case study column here more to the middle. And that's important because I think that, the first steps in writing this case study are to place the clinical judgment model that you are using in this first column. Now, here I am using the national councils, but you could just as easily trade out the nursing process steps for this first column. And because really in the nursing process, assessment and analyze is kind of the very beginning of the clinical judgment measurement model as well. But I am going to kind of stick with that. So I have placed recognized cues, and then I added those educator prompts here. So you can see if you are working with a student in the simulation lab or in skills lab, you can prompt the student to answer these questions. What did you see? What cues are relevant or irrelevant to try to prompt the student along as you are working through the case. If it is a written case that you're presenting in class, well, then that's not relevant. Okay, so that won't be so useful other than to kind of cue your brain about what you're writing this case to elicit. The next column is the same as the author's expected behaviors, and I placed here basically the exact same words that they used: list normal findings to recognize, list abnormal findings to recognize, list signs and symptoms, and so forth. Conditioning factors, the exact same thing that the author had: environmental cues, patient cues, and medical records cues. So once we have kind of thought about this first step of the process, then we could maybe write a short beginning to our case. Once we've worked through all 6 of these steps, analyze cues. Okay, what are the connections between patho and client presentation? What are the connections that we want the students to make? Then we also want to say this is requiring what knowledge of the student. The student must understand the following. Boom, boom, boom. These facts. Once we have worked our way through all 6 of these steps, then we are really ready to write the case, which is why I put the case in the middle here, more so than at the beginning where the author had it. All right, so kind of taking this and understanding that this is our goal today to get to step 4. On Friday, when you're working with Dr. Hensel, or when you're able to attend Dr. Hensel's presentation, then you can continue to use this template if you like the way that it's working for you. And you can determine, which is the best type of item that fits this layer of the clinical judgment model. And from the literature, actually, we get direction about that. So the literature tells us that in the recognized cues, and this literature, this content comes from the National Council State Board of Nursing website. One of their newsletters talked about the best fit of item types for each step of the clinical judgment model. And so they suggest that using a hotspot or extended hotspot or extended multiple response would be the best fit of type for this level of the clinical judgment. And so now you are ready to choose from those two item types to now write your item, or to modify an item that you already have written into an NGN style item. And that is what Dr. Hensel's activity is going to be on Friday. And then I included, I think, the very important step of having a peer or other faculty verify that this particular setup here for the recognized cues, step 1, does meet this clinical judgment step, and that we have any notes about accuracy, currency, fidelity would go in that box there. So it's kind of like a round, a circular approach. You're writing, but you're having a peer kind of verify that, yes, you're on the right track. This is solid. This is the right level of rigor, and is true to the work of the entry-level nurse. All righty, so this is available to you on the website. So you have that in PDF form. And now I am going to very skillfully, thank goodness, switch over to my example. So I'm going to take a breath for a moment. I'm going to see if there are any questions. I'm going to have a drink of water. Crystal, if you can let me know if there's any questions in the chat box, I'd appreciate it.
I don't have any questions in the chat box.
Okay. All right, great. All right, well, here is my example that I worked up in preparation for today. And so last week, I teach kind of a med-surgy course that it's really called pathopharmacology, but in many other programs, it could be kind of part of a med-surg lecture. In our program at the University of Maryland, we teach pathopharmacology one day, and we teach med-surg, the nursing component and care part, the next day. So it's really just separating out the patho and the pharm from the nursing care. And so last week, I talked about respiratory conditions. Actually, the last couple of weeks, I've talked about respiratory conditions. And I got to thinking about a common situation that an entry-level nurse would find themselves needing to deal with. And so I placed my learning objective here. I say that the student nurse will recognize risk factors for, signs and symptoms of, and nursing interventions appropriate to the care of a patient with atelectasis. So I thought that's a very common example to provide you all across the age spectrum. Patients of all age may develop atelectasis due to immobility. And then we can see here how I have kind of imagined this patient in my head. And I have listed the normal findings that I want the student to recognize. And so I've begun to build my case here. So I typed in current vital signs, temperature 99.8. I'm actually going to zoom in just a little bit more. Temperature 99.8, blood pressure normal, heart rate normal, but a little high on the high end. Respiratory rate elevated, 22 breaths per minute, and oxygen saturation at 88%. I provided basic assessment. I kind of created this patient, it's a creative process. I say that the patient is alert and oriented, but appears fatigued, that patient reports cough with sputum, some mucus, and is short of breath when working with physical therapy. And that my objective assessment included, in my case, crackles heard in the bilateral bases and decreased breath sounds. And so from that kind of pretend scenario, I am identifying that I want the student nurse, to recognize that the blood pressure and heart rate are within normal limits, the patient is alert and oriented, that I want them to notice or recognize that there are adventitious breath sounds are present, mild to moderate hypoxia, mild to moderate dyspnea on exertion, and that they appear overly fatigued. I want the student nurse to list signs and symptoms that they recognize. So patient reports cough with sputum. And I listed all of this as I was kind of developing this part of the case. The crackles are present, respiratory rate is high. I want the student nurse to recognize key factors. So the nurse is caring for an 88-year-old patient who is 3 days post-op, right ORIF of the hip after a fall. Patient transferred to skilled acute rehabilitation unit this morning. So this is a nurse in a skilled rehabilitation center. So I want the student to recognize that recent surgery with anesthesia, older age, and recent limited mobility are the risk factors that the student should be able to glean from my case. And I also put a medical records queue that limited to transfer summary from acute care hospital. So that might come into play in my case, that there's limited information. Now I can decide as the creator of this case where I place this information, where I kind of roll it out and how I roll it out. How will I present this information to the student? Will I have a table that looks like a medical record with a tab at the top? Honestly, I don't think that the appearance is the primary important thing here, primarily important element. I think it's really the content and the level of thinking that the student will be doing when they're faced with this patient who has some abnormal findings. Are they recognizing these abnormal findings? Now, Friday, you can think about how you might measure that they are recognizing these abnormal findings. Maybe you create this paragraph and they have to do the hotspot, extended hotspot, marking the abnormal findings to report to the provider. All right, and so then what I did for you today, working in your breakout rooms, which will be in just a little while, because I recognize it's going to take a few minutes for you all to kind of get to working on this. I put each step of the clinical judgment measurement model on one page. So this is step 1, recognize cues. Now we'll go to step 2, analyze cues. So what is the purpose of this step in the clinical judgment model? We want to measure, is the student able to make connections between pathophysiology and client presentation? What data links together here, as you see in this kind of educator prompts? Are there any patterns? So when we think about nursing process, right, we're clustering and bringing like data together. And so I said that what the connection that I want the student to make is that decreased activity leads to increased risk for atelectasis. Now, this is straight out of my lecture from last week. Also, straight out of my lecture content, recent general anesthesia leads to increased risk for atelectasis. So these are the key kind of pathophysiological knowledge nuggets that the student should come away from my class where I discussed atelectasis knowing, okay? And what findings and observations are needed. So again, I have, what does the nurse think is going on? So you might ask the student, what is going on here? Develop a list of potential things that could be going on with these signs and symptoms. And the student nurse might also need to determine if a recent or baseline chest X-ray results are available. So, I mentioned that in my class, right? How will we know that the patient has atelectasis other than our physical assessment findings It is a common finding in a chest X-ray. So these are the kind of analysis knowledge nuggets that the students you are hoping take away from that class. Here, the authors in the template suggest that we list the requires knowledge of. So being able to analyze the cues requires knowledge of risk factors for atelectasis, signs and symptoms of atelectasis, and pneumonia, another potential condition that could be developing here, and nursing assessments and diagnostic testing for evaluation of atelectasis. Now, I put here in red just kind of a cue to us all. In this step, analyze cues, the student nurse will begin to form a hypothesis about what might be going on: pneumonia, atelectasis, or another respiratory issue, right? We don't always know what's going on. So we have to have sort of an idea, though, that it's something respiratory, and it might be atelectasis or something more severe, such as pneumonia. And now this is additional data that I am going to present at this point of my case study to the student nurse. So the student nurse notes that there is a preoperative chest X-ray. Results are within normal limits. So you might have that on a diagnostic tab, a preoperative chest X-ray. You can be as creative as you want when you create these to deliver to the student. Also, that at this particular time point could be a narrative note that the patient is assisted by physical therapy to sit at the bedside to complete personal care activities, and the patient continues to report fatigue. So the patient continues to feel fatigued even with the support and assistance of physical therapy. In my example, the next layer is layer 3, prioritize hypotheses. So at this level, what is the priority issue? What is the likelihood? What is the risk? I said the student nurse should identify patient at risk for atelectasis and or pneumonia. And again, requires knowledge of risk for atelectasis, signs and symptoms of pneumonia versus atelectasis. You know, how are they similar? How would a student nurse separate the two out from in the clinical picture? Might be the fever, the presence of a fever. And then I would indicate the textbook resource, the PowerPoint, you know, where you are getting your information from, your content from. From this step, the student nurse should be able to select the correct issue or concern from a list. So prioritizing the hypothesis when you go to think about what item type and what will your actual item look like. Think about the bow tie, for example, where you have conditions in the middle and the student nurse needs to be able to place the likeliest condition, you know, in the middle of that. Now in this, we're using NGN type, not the case study types of items, not the freestanding. So it might be a matrix item where it lists 3 or 4 different respiratory conditions, and the student nurse has to indicate what is likely, what is not likely from that list. And nothing additional was added to the case at this step. And then step 4 is to generate solutions. And this is where the nursing interventions come into play. So what must the nurse address? And here are the educator prompts. If you need some background knowledge about what should I be thinking about during this step, you know, what interventions are possible? What solutions did the patient need? What evidence do you have for the solution? Where did that come from, right? What risks are related to your solution? So here I've listed what must the nurse address. The nurse must address the low oxygen saturation, the presence of crackles in the bases, reduced breath sounds, that there's no recent chest X-ray to look at. What must the nurse avoid? Well, there would be concerns of overexertion of the patient during this time of hypoxia, enhanced risk for falls. So something to think about the risk and the safety issues when we are intervening with our patient. And so list potential solutions. So I have listed use of incentive spirometer is needed. The student nurse needs to know that a set of spirometer is a possible intervention. The usefulness of deep breathing exercises, the need for follow-up assessment and time frame. And, the healthcare provider will need to evaluate the patient and their diagnostic testing that might be needed or any medication interventions that might be needed. So from this step, generate solutions, the student nurse should be able to generate a list of potential nursing interventions to select those that are indicated or not indicated. Okay. And then, that you'll keep that in mind when you're thinking about your NGN item type that you're going to be developing for this step. Additional data that was added. So I added a set of healthcare provider orders that the healthcare provider wants to see a chest x-ray in the morning, incentive spirometer at the bedside, teach to use, cough and deep breathing, monitoring pulse oximetry, applying oxygen if the nasal cannula oxygen, if the oxygen saturation falls below 88%, and add a bed with PT twice daily. So now we're at the take action. So now the student nurse should be able to select which are the priority nursing interventions from a list. Now you'll have a list that will include, when you're writing your NGN item type, you'll have a list that will include some of these things as well as some incorrect responses, right? Some distractors. So these are the items that you want to consider including in the list that the student will choose from. Teaching the patient the use of the incentive spirometer, coughing and deep breathing, monitoring PT, and tolerance of physical therapy with pulse oximetry pre and post activity. Assessment, worsening of symptoms, documenting shift assessments to include above. Requires knowledge and experience with, again, I've listed here what knowledge the student nurse will need to have. And then I added one little bit of additional data to the case. So this is an unfolding case. Patient was taught proper use of incentive spirometer, benefits of coughing and deep breathing, and to report signs of increasing work of breathing to the nurse. And so the last step then will be the evaluation step. And as I have here in red, from this, the student nurse should be able to generate a list of symptoms to monitor, listing signs of improvement or worsening patient condition. Student nurse should be able to list assessment findings to document and to reassess and what to report to the primary or to the healthcare provider. And so, of course, the nurse should assess kind of the typical things that we think about, but remembering that we need to teach our student nurses signs and symptoms of worsening respiratory status. So are they able to recognize those? Decreasing oxygen saturation, increasing respiratory rate, worsening of activity tolerance or anorexia, other symptoms that present themselves. So this is my example of sort of using the modified template to develop a case. And we'll go back to the PowerPoint and hold on one second, please. We'll share that.
Kathy, can you take a couple of questions?
Sure. And I actually have, let me just get this lined up. I have the template in the PowerPoint, so I will be able to refer to that. So there we go. So what are the questions that have arisen?
First, let me just say that you're sharing presentation screen.
Oh, thank you.
And these questions came up just as you started to explain the template.
Okay.
So the first one is, would this tool or method only work for simulation, or could it be useful for self-directed case study work?
I definitely have developed this with case study writing in mind. I have only included a few elements that may help the educator, such as, and I'm going to just get my little pointer out here if I can, such as the educator prompts. So the educator prompts here, let's see what has happened here. This section here are there for use if this case were to be used in simulation or in a basic nursing skills lab. But more importantly, those prompts are there because it really helped me to refine my thinking about what I am going to try to measure as an outcome at this step of layer 3 of the clinical judgment model. So while those prompts are there and can be very and would be very useful in simulation or in the skills lab, the development of this template really was to result here in the step 4 column, developing an unfolding case study that keeps clinical judgment at the forefront. And then in the columns to the right, what type of item should I be thinking about that aligns with this layer? And then on Friday, thinking more about writing an item or revising an item that you already have to fit this NGN style of question.
Okay. The next question is, what are your thoughts about incorporating the NCLEX RN activity statements into the template based on client needs?
Okay, can you say that one more time? I'm not exactly sure
Sure.
the origin of that question.
What are your thoughts about incorporating the NCLEX RN activity statements into the template based on client needs? And
So, okay, go ahead, Crystal.
no, I was just going to say, if you need more clarification, I can ask the person who asked the question to be unmuted and
if I'm thinking correctly, and certainly they can clarify their question, I think they are thinking about the NCLEX test plan and the categorization of the topics on the NCLEX test plan. So please correct me if I'm wrong about that. I really am not clear on what they're referring to. So if you can get some clarity on that.
Lynn, would you like to unmute and ask your question directly? Okay, I'm not hearing anything.
Right.
So,
and this template is designed and was designed by the authors to, not be specific to any particular care setting, any particular patient population. As we're going to experience when we go to the breakout rooms, we are going to be working in groups with faculty of similar interest, and to work our way kind of through columns 1, 2, 3, and 4, but using the Word document that I showed you, which kind of goes, one step at a time. So the full template is available on the website in a PDF. That is this that I am showing you here. This is the next page of that. It includes step 3, and across step 3, the item type that you will be writing. And then the last page that rounds out with step 6, which is to evaluate the effectiveness of the interventions that the student nurse has chosen. So this was an opportunity for you to, number one, slowing down to take a minute to think about the clinical application of your concepts that you're teaching in the classroom. So that in and of itself can take a moment of your time. and honestly, I was telling one of the groups, I started off with a much more complex topic. I thought my topic would be the entry-level nurse should be able to interact with a patient having chest pain. And the more I thought about it, I thought, no, honestly, if a patient had chest pain, an entry-level nurse would really likely go and get assistance from a more experienced nurse. So I had to even take time, and I actually usually do most of my creative thinking in the shower. I know it's very unusual, but it limits the input. It helps me to relax. And when I'm really working on a problem, I am pretty successful at either taking a walk or taking a shower and just really slowing down my brain enough to think. I thought, atelectasis is a topic that an entry-level nurse should be able to recognize, should be able to intervene, should be able to know what the physical assessment is for that. And I switched gears. So I think for many of us who are just so used to presenting content and topic after topic after topic, one of maybe the harder steps for us will be breaking down our learning objectives into those finite, clinically oriented topics that our students as entry-level nurses need to be able to recognize and should be able to assess and analyze and have an understanding of what are some of the nursing interventions that are appropriate for this patient in this situation. So I think for me, I'm a very structured person. Using this template really guided me through the process. And I hope that it did that for you. It really reminded me every step of the way to add more to the case as it unfolded, to be thinking about the type of item that I will be writing related to that step of the clinical judgment model. And it really just caused me in a lot of ways to slow down and to really break apart the process so that I will now be able to write a more effective case study that is authentic and meaningful for the students to use and break down and use in class or in their study groups, however you plan to deliver this. So I have my contact information here. You can find me in the directory at the University of Maryland School of Nursing. And in the handouts, I did include all of the references that I used to create this presentation. You will see that really these National Council State Board of Nursing newsletters that come out quarterly really contain a lot of the information that is essential to our being prepared as educators to prepare our students for spring of 2023. And I'm going to take it off share now. And if you'd like to turn your camera on, if you have any last minute questions, it is 5 o'clock. I recognize that the recording will be ending, but I'm here. And if we want to go even after the session is over, we can have a question and answer session. So would you like to put your questions in the chat? Crystal is monitoring that for me as well. But I'm so glad that you attended today. And I will be recording a little supplemental piece that will go on to the end of this, that will sort of take the time that we did in the breakout room and really go step by step through my thinking process through the use of the template, like I would if I was working in a group. So that'll be available with the enduring materials.
Just have one quick question, Dr. Martin.
Sure.
So while we were doing, I know the template was so handy to create a scenario right then and there. But then I'm also stepping back and thinking, how do we step from here to prompt student for critical thinking? Is there any second version of this or advanced version of this? How do we go from here, like for the critical thinking aspects?
Yeah, so the whole series of presentations are really designed to be attended in a chronological way if you are able to. So this Friday's session, you can use that template that I provided you with today to try to write up a little unfolding case study that then on Friday, you will be attending at noon a session about how to write NGN style questions. And that could be related to your case that you're working on. And in the template, I provided you with what the literature says are the appropriate NGN style items for each of the 6 steps. And as we work through this whole series of professional development offerings, we are going to be having, we have 3 presentations by Dr. Hensel. The Friday is just the first of 3. And then we have a whole set where we talk about using clinical judgment in the classroom. I'll be doing a couple of those. We have a whole set on clinical. We have a set on simulation, and then we have a whole set on testing. So through next spring, you will be getting all of the materials that you need, hopefully. And of course, you'll feel some pressure probably to start developing some of these cases to use in the classroom, in simulation or basic skills lab. You can send me your question if you have a specific question. I'm happy to answer it. But I think that we're kind of just in time with these offerings, right when everybody is really ready to start thinking about this. Your first step, though, is what are you going to do about your curriculum? This is what Dr. Billings talked about last week. If you haven't seen that one, watch that one first. What are you going to do about your curriculum? Are you picking a clinical judgment framework or model? And how will you integrate that throughout your courses, clinical evaluation, all of that? So that's really the first step. Well, thank you so much for attending. I know it was a lot of different documents, but we've tried to provide those to you as well, because it really is kind of a hands-on type of a topic today. And trying to do that on Zoom is pretty challenging, but I think we managed our way through it as we have been for 1.5 years. So it's great to see you all and so many familiar faces. How is it that I know so many people that are here? All right, guys. Sonia,
Thank you very much.
This content is being made available for those participants who are watching the learning activity using the website in the enduring materials. What I'm going to be sharing with you today are the comments that I responded to as I visited with each breakout group during that component of the activity, so that you can hear from what I learned while going from room to room with the various nurse educator groups. The groups were organized by interest areas in nursing, clinical nursing, med-surg, psychiatric mental health, pediatrics, and OB or women's health. What all the groups struggled with, of course, is the first step, and that is selecting an appropriate learning objective for the writing of the case study. And the difficulty with that step is in converting factual content that you might be teaching in a classroom in a mini lecturette or in a lecture or in a recorded presentation if you use a flipped class approach, and taking that sort of factual bulleted content and converting it into a clinically relevant topic for a case study. And then the next step, we will look at the process for developing the case study and just a few of the slides, some of the feedback that I was hearing as I was visiting with each group. And then also just a few comments about how much time this writing of the case study may take you. Okay. So let's see if we can advance the slide here. All right, so the very first step in writing a case study is to identify a specific learning objective. And it was pretty consistent in going from breakout group to breakout group that that was a very difficult first step. When I was considering the very first step of the clinical judgment model and what I was going to write my case study about, I first began with a sort of a really big, difficult concept. And I think that's what the groups were doing as well. They were kind of thinking of something acute or very critical care. And I started with the idea of recognizing a patient who is experiencing chest pain and acting appropriately and responding appropriately. When I met in the breakout groups with the attendees, they too were selecting really complex and sort of more difficult to manage topics. And upon my personal reflection about this, I thought, well, remembering that the case is to be built around a very common experience that any entry-level nurse would be expected to know how to assess and respond to, right? Assess, evaluate, analyze, and respond to appropriately. And so that kind of really made me step back. And I encouraged the one group that I worked with specifically about this sort of first step was the psychiatric mental health, one of the psychiatric mental health groups, and they were really struggling. So I said, place yourself in the clinical environment with a brand new entry-level nurse who's been hired on your acute adolescent unit or whichever setting they were comfortable with. And think about a scenario that would play out maybe almost every day that you would expect an entry-level nurse to be able to recognize, identify the cues, identify the change in patient behavior, identify the change in the milieu, the environment, nonverbal cues, body language, interactions, maybe verbal cues that you would expect an entry-level nurse to be able to determine is an elevation in sort of the excitement level on the unit, the agitation level of a particular patient or participant, let's say if it's a day program. And, what are those cues? What are those observations? As we have here in the educator prompts, what did you see? What cues are relevant or irrelevant? What should that entry-level nurse or student nurse be able to detect and recognize as a potential issue? And I did that same kind of thought process with my case. I originally, as I mentioned, thought about having a case where the graduate nurse or student nurse would be able to recognize and know how to act with a patient who is having chest pain. But I very quickly kind of realized that as I was kind of working through these expected behaviors, listing the normal findings to recognize, listing the abnormal findings to recognize, signs and symptoms, key facts. I mean, this is just providing you, the nurse educator, with a variety of ways to kind of frame this beginning step of your case study. I realized very quickly that an entry-level nurse with a patient who has chest pain would immediately get a more senior nurse. We really don't want an entry-level nurse managing a patient with acute chest pain by themselves. And so I shared this with that group and I said, we are thinking at this point of commonplace entry-level scenarios, which is why then I moved to a piece of content that I had actually taught just the week before in my pathopharmacology class, which is very similar to some med-surg courses, part of what you would teach in the respiratory content. And that was, atelectasis, recognizing the risk factors, who's at risk for atelectasis, what are the signs and symptoms that we want an entry-level nurse to be able to recognize, and what are some of the nursing interventions that we would expect an entry-level nurse to be able to create a list of, what are some of the things I might choose from for this patient, and then selecting action to take action to actually, from that list of potential things that we could do for someone who is experiencing atelectasis, to actually take action and evaluate the effectiveness of our action. So that really helped that group to, identify, okay, I was thinking way too difficult, way too big. Let's move back. I gave them another example of a patient who is a new admit, who you don't know that much about. So what are the body language? What are the facial cues? What are the family cues? What are you going to look in the medical record for? What about the social history? So in the psychiatric mental health environment, when you have a new admission, what are the parameters for providing a safe environment? And I would say safety, personal safety for the entry-level nurse could be another focus of the case, in that you are wanting the entry-level registered nurse in the psychiatric mental health environment to understand, or really any environment, right? We have a new admission patient who has a medical condition, but also has a psychiatric mental health component. How will that entry-level nurse manage themselves in a situation where anxieties are rising, patient anger is detected, family member agitation is part of the picture, and we want that entry-level nurse to be able to maintain a safe environment for all, for themselves as well as the patient. So again, another example of how we need to take our learning objectives and really think clinical. What did I just teach? How will the entry-level nurse use that information that I just taught in the clinical environment? How will they apply it in the clinical environment? And, if you need motivation and inspiration, certainly going in and visiting your clinical instructors, kind of getting a feel for the things that are currently, situations in clinical, or that the clinical instructors are having to manage, the students are having to manage. Get yourself back in touch with that clinical side of your practice. And so here, from my example, you've got the learning objective there. I began to build from that learning objective the background of information about my patient, which is a med-surg patient. I added from that scheme some of the contextual elements, the age of the patient, if that's relevant, recent surgical history for this patient, kind of creating an example of a patient that is real life, right? And they are in a setting that is unique. So this patient was transferred to a skilled acute rehabilitation unit for rehab. And so it's kind of a back and forth from your learning objective. And now I'm going to paint a picture of this patient. And this is the beginning part of the case study. And what I did in my Word document template that you can use is I kind of, in red there, reminded you for each step of the clinical judgment measurement model, or clinical judgment action model, whatever you want to call it, layer 3 of the clinical judgment model, what is sort of the task at hand? So from the development of the beginning of your case study, the student nurse will identify normal versus abnormal assessment, relevant versus irrelevant findings. And then kind of on your table, you are documenting, if you will, all right, so what are the normal findings that I want this entry-level nurse or student nurse to recognize? Vital signs, blood pressure, heart rate are normal, patient is alert and oriented. What are the abnormal findings that I want to build into this case story that I want my student nurse to identify? Now, listing these things, I did then go back to my med-surg, textbook. And I reread that section on atelectasis to make sure that I am including, the relevant physical assessment findings, that I am including the risk factors. So recent surgery, so key facts to recognize down in that very bottom cell there in the center. List key facts to recognize. This is straight out of the textbook. So recent surgery with anesthesia is a risk factor. Older age is a risk factor. Recent limited mobility is a risk factor. So just kind of keeping that in mind as I'm moving through the development, using the template to guide me so that I don't miss any steps, and then moving through the development of this story. So this case study is a story. And then just to kind of remind you as you're moving through, you are going to be then moving on to the next step. Once they've recognized the cue, then they need to analyze the cue. And so again, in the educator prompts there, what data link together? What goes together? Are there patterns? And this is a place where you are going to be documenting, what are the connections between pathophysiology and client presentation. So for my example, and what I was hearing in the breakout groups too, now this is very much in a textbook. Over there on the right, I have, what this student must have a knowledge of in order to be able to analyze the cues in this case. They must know risk factors for atelectasis, signs and symptoms. What are the appropriate nursing assessments, and maybe diagnostic testing. And, keeping in mind that an entry-level nurse should be able to anticipate certain diagnostic tests that will be expected to be ordered. And if the medical provider doesn't order those tests, then that would be something that the entry-level nurse would be expected to ask about. Now you can see here in the bottom in red, again, I included from this, the nurse will begin to form hypotheses of what might be going on. So when they are in the phase of analyzing the cues, they are then beginning to form that list of potential hypotheses. And again, what do they think their priority potential issues are? And I've listed here that, this patient, in addition to having atelectasis, could have pneumonia, or they could have another respiratory issue that presents in a similar way. So just kind of to show, as we moved through the breakout groups, once faculty were really able to identify a simple and clearly stated learning objective, and then using your textbook resources, the same resources that the students would have, you will then be able to generate the content from layer to layer. At the very bottom there, you can see then I'm adding more content to my case, to my story. And the student nurse notices that there is a preoperative chest x-ray and the results are within normal limits. So then this data is presented in the case at that time. So the data was not available earlier. And so we want this to be sort of an unfolding set of content. All right, so I hope that this was helpful to you to, let me stop sharing here real quick, to be able to understand what I was interacting with in the breakout sessions, and how once faculty were able to very clearly state a learning objective for their case study, they were really able to use their textbook resources and develop a very sound and rigorous case to then work their way through each step of the clinical judgment model. As you are writing the component of the case study and adding that language and those words, as you move the student through the case study, then you are able to start to think about, how will I measure the student's recognition of those cues? And thinking about then Dr. Hensel's presentation that talks about the various item types and what you might choose, like a hotspot or an extended multiple response type item, so that students can pick from the list the important and relevant or abnormal assessment findings. So, and moving through that layer 3 of the clinical judgment model. So I hope this was helpful, even though you couldn't participate in the breakout sessions. Or if you did, if you still kind of find this wrap up to be helpful to you. So have a great day and enjoy the rest of your week.